Africa carries about 80% of the global malaria burden, and the disease is estimated to rob the continent of $12 billion per year in lost productivity, investment and healthcare costs. Experts say progress has stalled in the fight to get the disease under control. However, according to the World Health Organization, the Comoros is among the 6 African nations on course to eliminate malaria by 2020 with the help of Chinese scientists. CGTN's Uche Okoronkwo is in Grand Comore, the largest island of the Comoros nation, to find out how it has managed to achieve this.
Years of political instability has left these tiny Indian Ocean islands trailing at the bottom of the UN's Human Development Index. In terms of life expectancy, standards of living as well as education, Comoros places at 165 out of 189 countries globally. But as it struggles to climb out of poverty, Comoros is winning the fight against the deadly malaria disease. 5 years ago, a Chinese-backed project helped these islands completely drive out malaria.
Before we launched the project in 2008, 68% of hospitalization were caused by malaria. That's the reason why the government at the time made the decision to end these frequent hospitalizations, especially the deaths of children from 0 to 5 years old due to malaria. Though we were taking medications and using insecticides, the objective of this program was to eliminate the actual cause of the sickness, which meant eliminating the chain of transmission.
Between 2007 and 2013, a team of Chinese introduced a Chinese-developed drug called Artequick. The drug required locals to simultaneously take medicine to flush out malaria parasites in a procedure called MDA, which made them less likely to build drug resistance. This unconventional approach resulted in a 98% drop in malaria cases. A key part of the project was making the medicine free.
Our calculations found that every hospitalization cost people over $30 US. So if every family had to hospitalize 2 or 3 people each month, the cost added up to thousands for the typical family. That was the most important aspect that pushed the Ministry of Health to make this move.
5 years after the success of this project, we decided to check in on its progress. We found that the country has now formed its own malaria monitoring team that visits various villages daily, collecting blood and mosquito samples which they analyze.
We have about 315 health agencies in these communities. We have 22 people who monitor in 19 zones. Our system is like a pyramid. It starts at the base with the surrounding villages and goes all the way up to those who monitor and study the results.
What they did find is a clear reduction in the number of malaria cases. However, the largest island, Grand Comore, is seeing a resurgence of the disease due to the constant movement of people in and out of the country.
99% of the infected come from the largest island. The other 2 islands did not register any cases from the native people. The few cases found were imported.
There were 0 cases of malaria, but now we are seeing an increase of 1 or 2 cases daily. Many of them are a result of people who already have malaria infecting others, and some people who have not taken their medication, mainly because there is no surveillance at the port of entry.
They also take the extra step of bringing together leaders of villages to help spread information and distribute the malaria drugs. The team works in tandem with Chinese scientists from the Guangzhou University of Traditional Chinese Medicine, sharing information with locals on anti-malaria capacity building.
China has got successful to obtain the malaria infection, so we really want to share our successful experience to the local people.
Today, the country has been able to keep malaria cases under 2,000 monthly. It plans to completely eradicate the disease by 2020. Uche Okoronkwo, CGTN, Moroni, Comoros.